Although the youth suicide rate has been decreasing this year, it's still a huge and worth concerning problem, since it is still the third leading cause of death of 10 to 19-year-old youth in 2012. And the problem of the blue whale, as it is mentioned in the news, is a suicide game on social media, which might be closely related to a concept of weather effect, which is an emulation of another suicide that the person attempting suicide knows about, either from local knowledge or due to accounts of depictions of the original suicide on television and in other media. However, the blue whale only contributes to a small portion of teen suicide. There are several risk factors responsible for a wider range of it. Firstly, pro-suicide attempt is one of the strongest predictions of future suicide. The risk is 30-fold for boys and 3-fold for girls. More than 90% of youth suicides have had at least one psychiatric disorder, such as depressive disorder, substance abuse, affective disorder, or disruptive disorder. So youth psychiatric disorder is another critically important marker for teen suicide. Additionally, history of self-injury thoughts and behaviors, youth with family history of suicide, parental psychopathology, LGBT sex orientation, or have recently experienced or experiencing stressful life events are more vulnerable to suicide. But this does not mean that a boy who is recently experiencing romantic difficulties with prior suicide attempts and has diagnosed as depressive disorder, who have the same sex orientation and whose mother was died because of suicide, will 100% kill himself. The risk factors could only tell us that who is at high risk, but not who will definitely commit suicide. For teen suicide prevention, there are several stages that we could do, and I have to emphasize the role of psychology in these stages. Since school-age teenagers are the major contributors of teen suicide, school-based suicide intervention could be one of the most effective approaches. Any sudden change in teenagers' behavior, academic performances, or attendance deserves attention. Also, since teenagers usually use a lot of social media, the content in their social media could be valuable in detecting potential suicidal thoughts or attempts. There are also many school-based mental health education and promotion programs, in which psychology plays an important role that could be helpful in reducing the suicide rate. An example that was proved to be effective is the Youth Aware of Mental Health program, which provides youth with a series of protective factors, such as a supportive group and a list of local mental health resources. Gatekeeper suicide prevention program in schools is another widely used suicide prevention strategy, which train people about the symptoms of suicide to increase the identification and referral of suicide individuals to the appropriate resources. It is inevitable that some teenagers would indeed commit suicide, and in this circumstance, post-suicide intervention strategies are needed to prevent further suicide events. By definition, suicide cluster is a group of suicide or suicide attempts, or both, that occur closely together in time and space that would normally be expected on the basis of statistical prediction or community expectation. Suicide appears could be traumatic to teenagers, which might create disturbance in the wellness of their mental state, and the affected teenagers might be more susceptible to suicide behaviors. Also, in this digital age, media reports, social media, and electronic communication technology may also be responsible for the contagion and clustering of teen suicide in some extent. Several strategies have shown their effectiveness, including actively providing a support group to the relatives and friends of the decedents, which allow them to express their feelings and mourn over the decedent under the guidance of a trained practitioner. Others like taking the susceptible individuals into a re-evaluation on the risk of suicide, especially for those teenagers in the same school as the decedent or was previously identified to be at risk, checking the status of school absentees in days after suicide events, making counseling available, and providing and distributing a list of local mental health services. Since media reports of suicidal event is another source of contagion, guidelines and media reports is also another critical aspect in the prevention of suicide contagion. The booklet published by WHO named Preventing Suicide, a resource for media professionals, is the guideline which could be used to supervise the report of suicide events in a responsible fashion. The do's and don'ts are listed as the following. And finally, there are some suicide prevention lifelines that could be used when needed.